Hello, my name is Cameron Schultz, and I am a researcher at the Technology-Enabled Clinical Improvement Center, presenting our work, The Use of Motion Tracking Technology to Define and Track Practice-Ready Performance Metrics, Precision Learning and Training is Now Possible. This work is a collaboration between Dr. Carla Pugh, the director of the Techie Center, Dr. James Korndorfer, and the American College of Surgeons Clinical Congress. Funding for this research was provided by the NIH and the American College of Surgeons. Motion tracking through the use of wearable sensor technology has been previously shown to correlate with expert and novice performance. However, it's not yet been used for skill development. This research aims to use motion metrics to create benchmarks for precision learning. So for this study, we hypothesized that using wearable sensor technology, key motion tracking metrics can be defined and identified in those deemed practice ready and subsequently used as benchmarks for precision learning. So we tested this hypothesis at the 2023 American College of Surgeons Clinical Congress, where we outfitted 94 surgeons and surgeons in training with motion tracking sensors under their surgical gloves. Each participant then performed 3 surgical tasks: intracorporeal suturing and knot tying, laparoscopic pattern cutting, and a simulated laparoscopic cholecystectomy. Expert surgical coaches also observed each participant complete these tasks before rating their performance using a modified simple scale. Post-data collection, we then divided the subjects into 2 groups according to their coach rating, practice ready and not practice ready. We then calculated benchmark performance for each motion tracking outcome, which we call motion metrics, using the median of the practice ready cohort plus or minus 1 median absolute deviation, depending on the metric. Table 1 shows the motion metrics of each of these groups and whether there was a statistically significant difference between the 2 groups. For our results, of the 94 subjects, 53 were rated as practice ready by our expert surgical coaches, and 40 were labeled as not practice ready. Differences between the practice ready and not practice ready groups were identified in 2 of the 10 motion metrics for intracorporeal suturing and knot tying, 4 of 10 for pattern cutting, and 5 of 10 for the laparoscopic cholecystectomy. Each subject's motion metrics were then compared to the benchmarks, and each subject was designated as either meeting or not meeting the practice-ready benchmark, as shown in Figure 1. The green designates that the participant has met the threshold for that particular motion metric, while the red indicates the participant did not meet this threshold. Then each subject's coach rating was compared to their ability to reach this benchmark. So participants labeled practice ready are shown here on the left and not practice ready on the right. And as we can see from the density of red over here, a not practice ready individual was less likely to achieve the benchmarks, which was also confirmed with a chi-squared test. So this illustrates that motion metrics are strong indicators of a participant's skill and experience level. So from these results, we can conclude that wearable sensor technology can identify differences between surgeons rated practice ready and not practice ready by surgical coaches. Additionally, motion metrics can be used to develop benchmarks for training endpoints, which may drive surgical training and skill development. This will allow for development of individualized training protocols, for example, where one individual may struggle with bimanual dexterity, which is a coordination metric. Another may struggle with path length, which is both an efficiency and a coordination metric. So training opportunities could be developed individually for each of these deficiencies, allowing for focused training instead of a one-size-fits-all approach. In the future, we hope to supplement these findings by calculating metrics for procedures other than laparoscopy in order to determine their generalizability for all surgical procedures. Thank you very much for your time.